In this video I'll show you the easy, effective way to treat or release trigger points in your back or backside muscles. Now the way you normally get shown to do this is to apply pressure with something like a ball or roller or a cane. Now if you had anything to do with these before, you'll know that those techniques are painful, hard to do, and the problem usually always comes back again. Now what I'll do instead is show you how to treat or release trigger points using a genuine vibration massager, which has huge advantages. Now, the most important being is that it's highly effective. Now, as this diagram shows, when therapeutic vibrations penetrate, they're scientifically proven to do all the main things needed to treat a trigger point. Now also, if you know anything about vibrations, you'll understand that they penetrate much better than pressing in. That's why ultrasound, which is vibrations, can go right through your body while the head of the machine just sits on the surface. Now this means that vibrations can easily penetrate deeply to get to the hard to get at trigger points, and even to the really important muscles that are tucked in places pressure techniques can never get to. Now obviously without pressure there's no pain, no risk of causing damage, and no risk of pressing on something sensitive like a nerve or a blood vessel. And that's pretty important because in my 27 years as a chiropractor, I saw a lot of people hurt themselves with balls and rollers. Lastly, using vibration is so much easier. Now, at the moment, I'm doing the same spot as the sky and the pick. Now, obviously this is a hell of a lot easier, and I don't need to even find the exact spot. As long as there's someone under the head of the machine, the vibrations will find it for me. Now, so you can get started to do a really great job on your own trigger points, what I'll do is show you the basic techniques, and I'll show you how to do it on each muscle, and then finally run over a few hints to help you stay safe and get the best results. Now before that, just a couple of bits of housekeeping. Now the first is you'll hear people talk about trigger point therapy, trigger point release, and treating trigger points. Now they're all practically the same thing, so the terms get used interchangeably. Now the second is that although trigger points are an important cause of back pain and treating them should be a part of most back pain care, there are other important issues. Now I'll place a link above to an article that discusses the causes of back pain further, but because of that, please consider this as general information and seek advice from a professional who can properly examine and assess you. Now, I'll show you the technique on the forearm where it's easy to see. Now basically all you do is find the trigger point, sit the machine on for 30 to 60 seconds, and then recheck to make sure it's gone. So let's start with how you find the trigger points. The basic examination technique is by starting with the flats of your fingers, looking for areas of general tightness and tenderness. Now if you find an area that's a bit suspicious, use the tips of 1 or 2 fingers to examine a bit more deeper, looking for tight bands of muscle or tender lumps that shoot pain when you're pressing them. So, how do you know where to look? Now, you may like to check all your lower back muscles, which is not that hard to do. Now, alternatively, when I go over the individual muscles, I'll list the possible symptoms and have charts like this showing you the common trigger points. Now, that can help narrow things down a bit. Now, the other good way is that when you see a professional, have him or her show you where all the important trigger points are. Actually, to do vibration massage, you don't even need to find them accurately, because as long as they're somewhere under the head of the machine, the vibrations will take care of them. Now you can do the general examination. If you find an area that feels a bit tender or tight, you know there's probably something under there, so just give it a good soak in the vibrations. Alternatively, your professional can give you some general areas to do. Now, if you're using the machine, I'll link above to an article with hints of precautions, but there are 3 main things you need to know. Now first, for cleanliness and to prevent skin irritation, you use the machine to lay of cloth or clothing. Now the second is, where possible, have gravity help you by trying to get the part you're massaging more horizontal. That way the weight of the machine applies the pressure and you don't need to support the weight. Now lastly, all you need to do is sit the machine on and let the vibrations do the work. There's no need to press in or move the machine around like conventional massage. In fact, if you do that, it doesn't let the vibrations soak in, so it'll be a lot less effective. So now you know the basic techniques, let's look at the individual muscles. Now the first is the paraspinal muscles. Now they're the ones that run down each side of your spine. Now you can find trigger points almost anywhere along these, and they can cause pain and stiffness virtually anywhere along your low back. Now the main issue as far as massage and trigger point therapy goes is that they're behind you where you can't easily reach, so you'll definitely need something with a decent handle like this. Now if you remember before I said that you try and have the part you're massaging more horizontal so gravity works for you. Now you could lay face down and hold the massager on your spine like this. Now I won't demonstrate that, but I'll show you an easy alternative. Now if I lean forward and put my elbow on my knee for support, my spine is a lot more horizontal. Now you won't be able to reach around and examine your paraspinal muscles, so what you do is let the massager do the examination for you. Now once you've been using the massager for a bit, you'll easily feel if it goes over a bit that feels a bit tight or tender. Now what you end up doing is moving the massager very slowly along your muscles. Now when you get to a bit that feels a bit tight, just let the machine sit there until it feels okay. Now another alternative for doing your paraspinal muscles is that if you've got one of our quad head massagers, you can use it like a chair massager. Now if you do that though, just make sure that you've got about the same pressure as you would using it normally. Now there's no advantage in pressing it in more, and if you use it with too much pressure you'll end up burning the motor out. Now with that in mind, there's a lot of chair and cushion massages available. Now some have rotating balls that work by pressure technique, while others have vibrations, but they're not really designed to do this sort of work, so the vibrations will be nowhere near effective enough to get to the deep trigger points. Now the next muscles we'll look at are the Quadrators lumborum muscles. Now this pic shows that they sit deep on each side of your lower back. Now, in these pics the X's mark the common trigger points, and you see most parts of the muscle can be involved, and Quadrators lumborum trigger points are so common in low back pain that if you have low back pain, I'll pretty much guarantee you'll have them. Now the muscles are pretty deep, so you'll have to push in pretty deep to find the trigger points, and unless you're experienced you can easily miss them. So what I recommend you do, if there's any sort of tightness or tenderness, just give the muscles a good application of vibrations anyway. Now the best way to do this is to lay on your side and roll forward a bit, and that way your muscle is nicely relaxed. Now you want to place the head of the massager about 6 centimeters above your spine, and you're working between the bottom of your ribs and the top of your pelvis. Again, after a while you get to be able to feel if the vibrations have found a tight spot, so if you do, let them soak in for a bit. If you've got one of our quad head massagers, it's really simple. Now I just sit the massager with the two heads either side of my lower spine and just let the vibrations soak in for a couple of minutes. Now that does all the Quadrators lumborum muscles, both sides. Now again, just make sure you only use about the same amount of pressure you would if using the machine normally. And next we'll look at the iliopsoas muscles. Now as these pics show, they sit at the back of your abdominal and pelvic cavities. Now they can cause pain in your back or front of your thighs, when it's often worse with prolonged standing or standing from a deep chair. Now there's a lot of sensitive structures overlying these muscles, so it's best to leave those to a professional, or at least have one show you how to do it safely. Now the next muscles we'll look at are the glute muscles, which as shown in these pics make up your buttocks. Now these have several layers with a few other muscles. Now this piriformis muscle, which a lot of people have heard because it can get tight and press on your sciatic nerve. And it's also a collection of small muscles deep around your hip joint. For self-trigger point therapy though, there's really no need to know all this. Now, all you do is just systematically examine your backside muscles and take care of anything you find. Now, if you lean to the side, you can very easily do this. Now, I'm examining my backside muscles now, and if I find something, I can easily apply vibrations. Now, I can also massage these muscles laying on my side, getting gravity to help. Now, for the muscles at the side of my glutes, I'm lying fairly side on, but to do the ones towards my back, I rotate forward a bit. Again, this single head massager will do a fantastic job, but if you have one of our quad head massagers, you can do a big area of your backside muscles at once. Now the last muscles I'll show you, the deep ones around your spine that move and stabilise your spine. Now these are highly important. Obviously if they're tight, they'll stiffen up parts of your spine. But if they're tight or not working properly, they can badly affect the function of your spine. As a simple example, if they're tight on one side, it'll tilt your spine, throwing everything above out of balance and causing parts to rub together and get inflamed or damaged. Now, this next bit is very important. Now, despite being extremely important, if you go to a professional therapist who uses conventional massage or use some techniques like a ball or roller, these problems will still be there, guaranteed. Now the reason is that they're so deep and sit between bony levers poking out from your spine, so a therapist can't even feel them and the pressure techniques can't get to them. On the other hand, if you're using something like this, the vibrations will easily penetrate and get to them and do a fantastic job. All you need to do is sit the head of the machine over the area next to your spine and let it do the work. Now, as I said before, these muscles are too deep to examine. Now, as long as it's safe, you can just shotgun the whole area by systematically doing the whole area of your spine. The best way to do it would be to have a professional to tell you where to do it. Now, we can't feel the muscles, but we can examine them indirectly by examining the movement of your spine. So that's a simple way of treating and releasing trigger points in your back and backside. Now I think you agree it's a lot easier and nicer than using painful pressure or getting into some awkward position with a ball or roller. Now what I'll do now is quickly go over a few things to help you stay safe and get the best possible results. Now the first thing to consider is whether you want great long-term results or just a bit of temporary relief. Now I mentioned before that if you use pressure techniques, the problem will almost always come back. It's the same if you get needles or laser. Now the main issue is that trigger point therapies and releases initially just quieten the trigger points down a bit so they're not hurting, which means they're still there and eventually start hurting again. Now to get rid of trigger points completely, scientific trials show that after the pain goes, you need to keep treating them for maybe another 50 or 100 times. Now if you're using a professional with needles or lasers, once the pain's gone, I doubt you're going to make another 50 or 100 more appointments. Also strongly doubt that you'll be very excited about another 50 or 100 sessions of self-inflicted pressure techniques either. Now the practicality of that is there's virtually no chance of needles, lasers or pressure techniques ever getting rid of your problem. Now that's the big advantage of these. Now once the pain is gone, you can easily keep doing it every day until the trigger points are gone. Then maybe once a week or once a month to stop them coming back. Now the next thing you need to do is avoid a percussion massage or massage guns and the techniques they advocate. Now I'll share with you why. Now what percussion massage or massage gun makers have done is modify vibration massages to make a marketing gimmick that's a lot less effective and a lot more dangerous. Now the easiest way to explain this is to use the analogy of a construction compactor versus a jackhammer. Now vibration massages are like these construction compactors. They send large amounts of vibration deep in the ground while barely scratching the surface. Now percussion massager marketers have modified their machines to drive their heads into the muscles, claiming that it penetrates better and adds the benefits of conventional massage. Now what they've really done is to turn their machines into jackhammers. Now remember, it's the vibrations that do the work. Jackhammers don't vibrate the ground anywhere near as much as a compactor, so percussion massages are far less effective. Now the percussion marketers claim that driving their heads in like a jackhammer gives better penetration, but if you look at those two machines, the jackhammer head goes in a bit while the vibrations from the compactor are probably still doing work a metre or two down. Now I hope you can already see the biggest problem with percussion massages. Now you can sit the head of a vibration massager like this on yourself and it's usually very safe. On the other hand, if you have a percussion massager head driving its head into the muscles, it can do all sorts of damage. Or worse still, hit something like a nerve or a blood vessel. So that's the machines themselves. They also said percussion massager techniques. Now these are power tools And just like most power tools, they work best if you just let them do the job. You just sit the machine on and let the vibrations penetrate. If you try and move it around like a conventional massager, you're not letting the vibrations soak in, so it'll be a lot less effective. However, the marketing gimmick of percussion massage is that they combine conventional massage with vibration, so that's exactly what they tell you to do. Now, percussion massage is very poor at delivering therapeutic vibrations anyway, so it probably doesn't matter with them. But I don't want to see you following their recommendations with a decent vibration massager. So, how do you find a decent massager? Now, I'll link an article above with full details, but they're not that common though. Now, most of the massages on the market are either ineffective consumer massages, massage guns, or both. Now, that's why a while back, to get something decent for our patients, we built our own, which are the two machines I've used here. Now, this is our general purpose massager. Now, we've had them for over a decade, and they're widely used and recommended by professionals across a number of countries. They're very solid and reliable. Now, the business end delivers strong therapeutic vibrations, and they have an ergonomically designed handle so you can easily use them anywhere on your body. But as you've seen, they're limited to what's under the head, so that's why we built our quad head massager. Now, I'll pop a link above to more info about how to get one. Now, if you have any questions or comments, please email them or leave them in the comments. Hey, thanks very much for watching. It has been most appreciated.